Did you know that your liver performs over 500 vital functions in your body? It's true, your liver is responsible for filtering your blood, producing hormones, storing vitamins, and much more. But sometimes, your liver can get overloaded with toxins from the food you eat, the alcohol you drink, or the medications you take. This can lead to inflammation, scarring, and even serious diseases like cirrhosis or cancer. But what if I told you that there are some special vitamins that can actually detox your liver and help it heal and repair itself? In this video, we will reveal the best 7 vitamins to repair your liver and how exactly to take them and how much to take. We will also share with you natural sources for these vitamins if you don't want to take supplements. You'll be amazed by the effects of these vitamins on your liver health. So without further ado, let's get started. Number 1. Choline. Choline is a nutrient that your body needs to produce a substance called phosphatidylcholine, which is essential for the health and function of your liver cells. Choline helps your liver break down fats, remove toxins, and regulate inflammation. Without enough choline, your liver can accumulate fat and become damaged. Choline also supports the production of bile, which is a fluid that helps your digestion and absorption of fats and vitamins. In a recent study done in 2020, researchers found that participants who took 1,000 milligrams of choline bitartrate every day for 12 weeks had reduced liver fat by about 40% compared to a placebo group. But how much choline do you need and where can you get it? According to the National Institutes of Health, the recommended daily intake of choline for adults is 425 milligrams for women and 550 milligrams for men. However, some studies suggest that higher doses of choline may have more benefits for your liver. So how can you boost your choline intake and protect your liver? One way is to take a choline supplement, which you can find online or at your local health store. Another way is to eat more foods that are rich in choline, such as eggs, liver, salmon, chicken, beef, soybeans, peanuts, and cauliflower. These foods can provide you with about 100 to 300 milligrams of choline per serving, depending on the amount and quality. Try to include some of these foods in your daily diet and see how your liver thanks you for it. Number 2. Milk thistle. Milk thistle is a flowering plant that has been used for centuries as an herbal remedy for liver problems. But what makes milk thistle so good for your liver? The answer is a compound called silymarin, which is extracted from the seeds of the plant. Silymarin is a powerful antioxidant and anti-inflammatory agent that can protect your liver cells from damage caused by toxins, alcohol, drugs, and viruses. Silymarin can also stimulate the regeneration of new liver cells and improve the function of your liver enzymes. For example, in a recent study done in 2018, researchers found that participants who took 140 milligrams of silymarin 3 times a day for 24 weeks had reduced liver inflammation by about 30% compared to a placebo group. They also had improved liver fibrosis, which is the scarring of the liver tissue due to chronic damage. In another study done in 2017, researchers found that participants who took 210 milligrams of silymarin twice a day for 12 months had reduced liver fat by about 15% compared to a placebo group. So how can you add milk thistle to your diet and detox your liver? One way is to take a milk thistle supplement, but make sure to look for a product that contains at least 80% silymarin, which is the active ingredient. Another way is to drink milk thistle tea, which you can make by steeping the dried leaves and flowers of the plant in hot water. You can also add some honey or lemon to enhance the flavor. Milk thistle tea has a mild and slightly bitter taste, but it's very soothing and refreshing. Try to drink 1 or 2 cups of milk thistle tea a day and see how your liver feels. Number 3. Bile salts. Bile salts are substances that your liver produces to help you digest fats and absorb fat-soluble vitamins. They also have anti-inflammatory and antimicrobial effects that protect your liver and intestines from damage. But sometimes, your body may not produce enough bile salts, or they may not be absorbed properly. This can lead to problems like fatty liver, gallstones, constipation, and nutrient deficiencies. That's why many people may benefit from taking bile salt supplements, such as ox bile or TUDCA. For example, in a study published in Liver Research, researchers found that TUDCA, which is a type of bile salt, reduced liver inflammation and improved liver function in patients with non-alcoholic fatty liver disease. The study showed that TUDCA lowered the levels of liver enzymes, which are markers of liver injury, by about 30% in 12 weeks. So how can you add bile salts to your diet? Well, you can find bile salt supplements in the form of capsules, tablets, or powders. You can take them with meals, especially those that contain fats, to enhance your digestion and absorption. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. N-acetylcysteine. N-acetylcysteine, or NAC for short, is a powerful amino acid that can detox and heal your liver. So how does it work? Well, it works by boosting your levels of glutathione, which is the most important antioxidant in your body. Glutathione is especially important for your liver, as it helps your liver break down and eliminate toxins, such as alcohol, drugs, pesticides, and heavy metals. It also protects your liver cells from oxidative stress and inflammation, which can cause liver damage and disease. NAC is especially helpful for people who have chronic liver problems, such as hepatitis, cirrhosis, or fatty liver. For example, in a study published in Hepatology, researchers found that NAC improved liver function and reduced liver inflammation in patients with non-alcoholic steatohepatitis, which is a severe form of fatty liver disease. The study showed that NAC lowered the levels of ALT, which is a marker of liver injury, by about 40% in 24 weeks. NAC is available as a supplement that you can take orally or intravenously. The dosage and duration of NAC treatment may vary depending on your condition and your doctor's advice. However, some general guidelines are to take 600 to 1200 milligrams of NAC per day for liver health and to take it with food and water to avoid stomach upset. You can also drink coffee, which has been shown to increase glutathione levels in the liver. Try to drink 1 or 2 cups of organic black coffee a day and see how your liver feels. Number 5. Selenium. Selenium is a trace mineral that your body needs in small amounts, but it has big benefits for your liver. That's because selenium works together with glutathione, the powerful antioxidant that protects your liver from toxins and inflammation. Selenium helps your body produce more glutathione and also recycles it, so you can use it longer. Selenium also helps your liver fight off viral infections, such as hepatitis C, which can damage your liver and cause scarring. For example, in a recent study published in the American Journal of Clinical Nutrition, researchers followed more than 477,000 people from 10 European countries for 14 years. They found that people with the highest levels of blood selenium, or selenoprotein P, which is the protein that distributes selenium from the liver to the rest of the body, had 35% lower risk of liver cancer. So how can you get more selenium in your diet? Well, there are many foods that are rich in selenium, such as Brazil nuts, fish, eggs, meat, poultry, dairy products, and whole grains. You can also take selenium supplements, but be careful not to exceed the recommended daily intake of 55 micrograms for adults, as too much selenium can be toxic. Number 6. Turmeric. If you're looking for a natural way to detox and heal your liver, look no further than turmeric. Turmeric is a yellow spice that's commonly used in Indian cuisine and traditional medicine. Turmeric contains a compound called curcumin, which is the main source of its health benefits. Curcumin has anti-inflammatory, antioxidant, and antimicrobial properties, which can help protect your liver from damage and infection. Curcumin can also enhance the activity of certain enzymes in your liver, such as glutathione-transferase, which helps flush out toxins from your body. In a 2021 study, 64 people with non-alcoholic fatty liver disease took either 2 grams of turmeric or a placebo every day for 8 weeks. The results showed that the turmeric group had significantly lower levels of liver enzymes, triglycerides, and cholesterol than the placebo group. This means that turmeric helped reduce the inflammation and fat accumulation in their livers, which are the main symptoms of non-alcoholic fatty liver disease. There are many ways to enjoy this spice. You can use it to flavor your rice, curry, soup, or salad. You can also make golden milk, which is a warm drink made with turmeric, milk, black pepper, cinnamon, and honey or maple syrup. You can also take turmeric supplements, but make sure they contain black pepper or piperine, which can increase the absorption of curcumin by up to 2,000%. The recommended dose of turmeric for liver health is about 500 to 1,000 milligrams per day. Number 7. Vitamin E. Vitamin E is a fat-soluble vitamin that can help prevent oxidative stress, which is a major cause of liver injury. Oxidative stress occurs when there are too many free radicals in your body, which can damage your cells and tissues. Vitamin E can neutralize these free radicals and reduce inflammation, which can improve liver function and prevent scarring. For example, in a 2010 study published in the New England Journal of Medicine, researchers gave either 800 international units of vitamin E or a placebo to 247 people with non-alcoholic steatohepatitis, which is a severe form of fatty liver disease. After 96 weeks, they found that the vitamin E group had 43% improvement in their liver histology. This means that vitamin E helped reduce the fat, inflammation, and scarring in their livers, which are the main signs of non-alcoholic steatohepatitis. So how can you get more vitamin E in your diet? Well, there are many foods that are rich in vitamin E, such as nuts, seeds, vegetable oils, leafy greens, and fortified cereals. You can also take vitamin E supplements, but be careful not to exceed the recommended daily intake of 15 milligrams for adults, as too much vitamin E can cause bleeding problems. So these were the best 7 vitamins to repair your liver according to studies. By adding these vitamins to your diet or taking them as supplements, you can help your liver heal from damage and prevent serious diseases like cirrhosis or liver cancer. Remember, your liver is essential for your overall health and well-being, so don't neglect it and give it the care it deserves. Now, we want to hear from you. Did you try some of these vitamins before? Did you experience some of these benefits? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.